Type 2 diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia due to a combination of insulin resistance and impaired insulin secretion. Genetic predisposition does influence disease susceptibility, but the etiology of type 2 diabetes is multifactorial, with lifestyle and environmental factors playing prominent roles. In this video we are presenting a comprehensive compilation of 27 established risk factors that contribute to the development of type 2 diabetes. So let's start. Obesity. Being overweight or obese is one of the most significant risk factors for type 2 diabetes. Excess body fat can lead to insulin resistance, where cells fail to respond to insulin effectively. Physical inactivity. Lack of regular physical activity is associated with an increased risk of type 2 diabetes. Exercise helps improve insulin sensitivity and aids in weight management. Unhealthy diet. Consuming a diet high in refined carbohydrates, sugars, and saturated fats can increase the risk of type 2 diabetes. A diet low in fiber and high in processed foods contributes to insulin resistance. Family history. Having a family history of type 2 diabetes can elevate your risk, indicating a genetic predisposition to the condition. Age. The risk of type 2 diabetes increases with age, especially after the age of 45. Ethnicity. Some ethnic groups, including African Americans, Hispanics, Native Americans, and Asians, have a higher risk of developing type 2 diabetes. Gestational diabetes. Women who experience gestational diabetes during pregnancy have an increased risk of developing type 2 diabetes later in life. Polycystic ovary syndrome, PCOS. Women with PCOS, a hormonal disorder, are at a higher risk of developing type 2 diabetes due to insulin resistance. Hypertension, high blood pressure. Hypertension is often associated with insulin resistance, increasing the risk of developing type 2 diabetes. Abnormal cholesterol levels. High levels of LDL cholesterol, bad cholesterol, and triglycerides and low levels of HDL cholesterol, good cholesterol, can increase the risk of type 2 diabetes. Cardiovascular disease. Individuals with a history of heart disease or related conditions are at an increased risk of type 2 diabetes. Sleep disorders. Conditions like sleep apnea can disrupt insulin sensitivity and increase the risk of developing type 2 diabetes. Stress. Chronic stress can lead to hormonal imbalances, affecting blood glucose levels and increasing the risk of type 2 diabetes. Smoking. Smokers have an elevated risk of type 2 diabetes compared to non-smokers. Exposure to certain chemicals. Some environmental pollutants and chemicals have been associated with an increased risk of diabetes. Medical history. Conditions such as prediabetes, polycystic kidney disease, and hormonal disorders can increase the risk of developing type 2 diabetes. Medications. Certain medications, such as corticosteroids and certain antipsychotic drugs, can contribute to insulin resistance and increase the risk of diabetes. History of pancreatic disease. Pancreatic diseases or surgeries can affect insulin production, leading to an increased risk of type 2 diabetes. Low birth weight. Individuals born with low birth weight may be at a higher risk of type 2 diabetes later in life. Hormonal disorders. Conditions like Cushing's syndrome and acromegaly can increase the risk of type 2 diabetes due to hormonal imbalances. Impaired glucose tolerance, IGT. IGT is a condition where blood sugar levels are higher than normal but not high enough to be classified as diabetes. People with IGT have an elevated risk of developing type 2 diabetes. History of mental health disorders. Some studies suggest a link between mental health conditions like depression and anxiety and an increased risk of type 2 diabetes, possibly due to the influence of stress and lifestyle factors. Low testosterone levels. In men, low testosterone levels have been associated with insulin resistance and an increased risk of type 2 diabetes in men. Polycystic kidney disease, PKD. PKD, a genetic disorder characterized by the growth of cysts in the kidneys, is associated with a higher risk of type 2 diabetes. High consumption of sugary beverages. Regularly drinking sugary beverages like soda and sweetened juices is linked to an increased risk of type 2 diabetes. History of liver disease. Certain liver conditions, such as non-alcoholic fatty liver disease, NAFLD, can increase the risk of type 2 diabetes. Metabolic syndrome. Metabolic syndrome is a cluster of conditions, including high blood pressure, high triglycerides, low HDL cholesterol, abdominal obesity, and insulin resistance, all of which increase the risk of type 2 diabetes. It's important to note that having one or more of these risk factors doesn't guarantee that you will develop type 2 diabetes. However, recognizing and addressing these risk factors can significantly reduce the chances of developing the condition. If you have concerns about your risk of type 2 diabetes, it's essential to consult with a healthcare professional who can provide personalized advice and guidance. Thanks for watching.